hear me right now? Please write something that you can hear me, you can see me, and then we can start. Yes, I see that you can hear me. Okay, let me introduce myself. My name is Olga Komenko. I'm a dermatologist. I'm Medical Affairs Manager of Institute Halal. And today we're going to talk about the Xela Rederm and about the solutions which we can solve, the problems and solutions where how we can affect the skin and to remove, for example, hyperpigmentation, the most demanded problem of our patient. So the Xela Rederm, a comprehensive solution for getting a healthier skin. And why do we perform the injections? Why we making all these procedures? So basically, our patients coming to us with some problems, and we want to help, we want to solve them. So first of all, it is the dryness of the skin, the dehydration. So that's why we're performing injections to the skin. Wrinkles on the face, loss of skin elasticity. So in one word, we can say the laxity of the skin. Changing face color, pigmentation. Sometimes some doctors preparing the skin for the ablative procedures such as laser, such as blepharoplasty, when we need to have the skin regenerate itself without sustaining any scars after the procedures. Some patients come in with the red spots, such as cuperosis or rosacea, and we want to help them as well. And young patients with the scars, post-acne scars, with the areas of hyperpigmentation, red spots, and also the density of the skin with the scars. So with one product, we can solve all these problems, and I'll tell you how we can do it. So the main concern of our patient is aging, and we need to prevent and treat the aging process. So as far as you know, all of you know that how we are having the skin aging. It's two basic mechanisms of aging: chrono-aging and photo-aging. Chrono-aging is not avoidable the process, and we are having it every day. When we're just born, we having the programmed DNA where the cell must die soon. So the apoptosis, it's unreversible. It is undeniable process. So the chrono-aging is happening to everyone. But photo-aging, it can be avoided if the patient applies the SPF filters. But when we are young and beautiful, we are exaggerating with the suntan. We go into the beach without any protection and having the suntan the whole day as far as we know. But in 10 years, then we are having the spots on our skin. We are having the sun damaged skin. So when we are young and reckless, we do not think about the aging process. But after, we start thinking about it more and more. So chrono-aging and photo-aging, how can we affect and reverse these problems? So both of them, the chrono and photo-aging, they can reduce and disrupt the collagen fibers, that they can damage elastin fibers. And also the dermal fibroblasts, they stop multiplying with the aging process because they do not have the support, they do not have hyaluronic acid inside the skin in extracellular matrix. So we are having the disruption of all this process. And in this way, we're receiving sagging skin with the wrinkles, with the laxity, and very dull color of the skin. Moreover, the immunologist Claudio Franceschi, he proposed the term of inflammaging. It is quite different from the acute inflammation because it's mild, it's asymptomatic, and it goes all around the year in our skin with the aging process. So we having the free radicals in our skin which are damaging our cells. And this term is quite recognized today in the medicine. And as a result, the human immune system with the variety of cell types changes over the years. So redermalization, it can affect the inflammaging, corona aging, and also the sun damage of the skin. Let's go through the redermalization and Xela Rederm. So the big difference between the normal biorevitalization agent and redermalization. What is the difference? The difference in succinic acid. Moreover, redermalization, it is the high molecular weight hyaluronic acid plus succinic acid. What is the difference between the high molecular weight hyaluronic acid and low molecular weight hyaluronic acid? As I told you about the Claudio Franceschi, that he proposed the term of inflammation. So the high molecular weight hyaluronic acid can affect the inflammation process in the skin. And I'll show you a little bit later the study. So the Xela Rederm, innovative product for complex correction of the skin, improvement of the skin quality by increasing its regenerative potential, so the skin redermalizes itself. So the hyaluronic acid and succinic acid, they work synergically. So hyaluronic acid, high molecular weight hyaluronic acid, it activates anti-inflammatory mediators, so it can affect the inflammation process. It restores and maintains water balance. Why do we need it? Because of the macrophages, so they can start multiplying and dividing. High molecular weight hyaluronic acid stimulates the synthesis of the basic structural proteins, and with the help with the succinic acid, so we are having more collagen and elastin fibers after. And hyaluronic acid has the mechanical support for the tissues. And again, macrophage, fibroblast, they start multiplying. Succinic acid, on the other hand, it normalizes microcirculation and activates lymphatic drainage. So you can work with the patient who has edema on the eyes, who has edema on the face, to promote the lymphatic drainage. And also, when you just start injecting, you will notice how the papules become reddish because of the increased microcirculation. So do not panic when you see that your procedure and the face of the patient became red. It is how the succinic acid start working instantly. So the succinic acid has antioxidant properties, and I will show you the study a little bit later. It prevents damage of the cell membrane, and it works inside the cells. It stimulates the synthesis of the basic structural proteins such as collagen and elastin fibers. And basically it is a breakthrough in the aesthetic medicine. Let me explain you more about the succinic acid. So working together, hyaluronic acid and succinic acid can block premature aging, and also the chronic inflammation, the inflammaging, it can affect it as well, and prevent the death of the cell by affecting the mitochondria, by affecting inside the cell. How is that? Because the succinic acid can have the mobilization of all strength and power of the cell through the energy exchange. Why is that? because the succinic acid, it is an intracellular metabolite of the Krebs cycle, and it is a product of the Krebs cycle. So basically the cycle which goes in every cell which produce the oxygen and CO2. So every breathing cell has the Krebs cycle. So in this way, the sodium succinate can improve the microcirculation in organs and tissues. It restores the acid-alkaline balance, increases the cell resistance to the hypoxia. It normalizes the level of pro-inflammatory mediators. As far as I told you about the inflammation, the mild, acute, and asymptomatic inflammation in the aging skin. So the succinic acid can influence on this process. And also succinic acid stimulates the energy production because it is the component of the Krebs cycle, which undergoes in mitochondria. So the succinic acid can affect the oxidative stress, which happens in every cell. How is that? Because it normalizes the electron balance in every molecule of the skin, in every molecule of the fibroblast. So we are having the battling process with the oxygenations, with the free radicals. So the succinic acid normally, it is inside this cell. It is inside of the mitochondria. But when we are having the hypoxia, when we are having the ischemia, the succinic acid appears outside the cell. And it is the process which is going in every cell in our body. And when the succinic acid is outside the cell, then the body recognizes that there's something happening bad in this tissue or organ. And it starts mobilizing the energy exchange. And when we are injecting the succinic acid from the outside, so the body recognizes, so there is the lack of oxygen in this tissue. And then it starts mobilizing the energy exchange. It improves the peripheral blood flow by facilitating of the production of the oxygen. So the improving microcirculation, and the more hemoglobin is coming to this site or area. And similar reaction of the body is manifested when it is not enough the oxygen in the tissue. So in this way, we are just like deceiving the body. We are giving the succinic acid outside, and body recognize that in this area there is an oxygen starvation. There is not enough energy. And body started mobilize the energy exchange. It starts improving microcirculation in this area. So in this way, we are having redermalization, that the body restores itself, and improving the microcirculation, improving extracellular energy balance, and also cell multiplying. So the succinic acid has two actions, energotropic action and the signal action. So when we are having energotropic action, when there is the hypoxia or ischemia is happening in the tissue, when there is not enough the oxygen in the tissue or the cells. So the succinic acid started mobilize lots of different enzymes to prevent the starvation of the oxygen. So in this way, the succinic acid helps the tissue to survive in the condition of the hypoxia. And on the other hand, succinic acid signaling to the other components of the body to come over and help us. So we are having the erythropoiesis and when we are having the new angiogenesis, so the microcirculation improving, the macrophage polarization, so the cells are coming to the side where the succinic acid is outside the cell. So we are having normalizing of vascular tone, we are having lymphatic drainage activation and fibroblast proliferation. So the new cells are coming to this side where the succinic acid is outside the cells. So the body started regenerating this site where the succinic acid is outside the cell. Moreover, there is a succinic acid receptor which was found on the highly energy dependent organ such as heart, kidney, brain. But moreover, this receptor was found in the skin. That's why we are working in the skin, because the receptor was found on the fibroblast, on the macrophage, and on the keratinocytes. So in this way, we can affect these cells and promote their multiplication and promote their transformation. Moreover, there was a study, you can find it on the PubMed, that the succinic acid affects the macrophages and make their polarization in a different way, alternative way, without any inflammation process. So usually macrophages, they activating because of the inflammation. And I told you before about the inflammation process which is happening in the aging skin. So the normal classical activation of the macrophage is going through the inflammation all the times with the cytokines of the inflammation. But with the succinic acid, we prevent the inflammation process. So the macrophages, they polarize to the alternative way with the macrophage M2. And they has the ability to reduce the inflammation process. Moreover, the macrophages which we are received already without any inflammation, they has the ability to promote the growth factors, fibroblast, vascular, and tissue growth factors. The same growth factors that probably you are hearing about in different congress about the PRP, the plasma injection. But what the difference? Because the PRP, it is the uncontrolled stimulation of the growth factors. With the Xela Rederm, the study showed that the stimulation of the growth factors goes up to the 7 days. After, on the 7 days, the growth factor declining. So we are not having the stimulation more than 1 week. So the procedure is quite safe. We do not have the uncontrolled stimulation of the cells. In this way, we can be safe that we will not stimulate any other cells which we do not need. I'm talking about the cancer process right now. So the hyaluronic product, Xela Rederm, is quite safe because we are not having uncontrolled stimulation of the cells, only up to 7 days. And after, we are having physiological restoration of the derma because the body restores itself. Another study showed in vitro how the human fibroblast cultivating with the presence with the high molecular weight hyaluronic acid plus the succinic acid. And you can see that in control group, there was the low percentage of the stimulation of the fibroblast. With the sodium succinate, quite better results, plus 73%. Hyaluronic acid solely gives the stimulation of the fibroblast, but working together in a synergy effect, we are having plus 182% of the new fibroblast in the skin. So why it's happening? Because the succinic acid on its way can stimulate the production of the new fibroblast as much as the hyaluronic acid as well. So working together, they achieving a quite great result. So when to carry out the procedure? What patient? Which patient to recommend? So we can tackle the first signs of the skin aging. We can correct wrinkles, folds. We can treat the acne scars, post-acne scars, and the spots after the scars. We can prepare the skin before the peeling, laser, ablative laser. Why? Because the cells will multiply after the procedure, after the restoration, much more better, without any scarring process. So we can prepare the patient for the plastic procedure, before the blepharoplasty, before the facelift, or thread lifting as well. We can treat pigmentation, hyperpigmentation. We can work with melasma. Also, moisturizing the skin, very dry skin. And we are preventing the photoaging as well. So the product, Xela Rederm 1.1, it is the percentage of the hyaluronic acid. But the succinic acid remains the same, 1.6 in every product. So what problems we can solve with the 1.1? We can reduce edematosis component and promote lymphatic drainage. We can improve microcirculation. We can lighten skin by 1-2 tones. And it is the best product to solve the dark eyes problems. So the circles under the eye. We can promote the lymphatic drainage and reduce the edema under the eye. And we can promote the microcirculation by reducing the bluish spots under the eyes, or sometimes they could be reddish, or reduce the hyperpigmentation under the eyes. The Xela Rederm 1.8. It is the best product to work with the wrinkling morphotype when we are having very dull, dry skin with lots of small wrinkles. So in this way, we will moisturize the skin. We will prevent it from the photo and corona aging, and also to promote macrophages, elastin and collagen fibers to make the sagging skin more tighter. 2.2. This product will solve the problems such as post-acne, scars. It perfectly works with the areas such as neck, décolleté, and also the hands. And I will tell you how to make the lifting effect with the Xela Rederm 2.2 with the work with the sagging skin. So basically, we are having the 4 main morphotypes of aging: tight face, deformative face with a lot of edema under the eye, wrinkling when there is lots of small wrinkles and dry skin, and muscular. So 4 morphotypes depends what patient came to your office. You need to start with the product, and this table will help you how to start treating your patient. So when we are having very dry skin, always start with the 1.8. In any others problems, you can start with the Xela Rederm 1.1 and gradually increase the percentage of the hyaluronic acid with the other 2 procedures. So the technique is popular. The papulas must be very small, 1, 2, 3 millimeters, no more, 5 millimeters apart. And also you need to inject very superficially to be into the derma, because we work with the main cell of the derma, fibroblast. So the injection must be performed into the derma, especially not subdermally, in the under eye area, because in this way, injecting subdermally, you can damage the malar fat under the eyes and have the edema after. So be precisely in the derma, and I'll show you a video how to inject after. Linear technique. retrograde linear technique, we needed to work with the sagging skin to promote the collagen production. So by vector linear technique, it is a different topic for the sagging skin. And I think we can meet up with this topic and discuss how can we work with the sagging skin to improve the lifting effect. So we can work with the neck and décolleté, because some doctors concentrate only on the face and forgetting about the neck and décolleté. But we need to inject the neck and décolleté because the neck will reveal the true age of your patient. And the technique is quite simple. Papilla, but be precise in the derma, inject superficially. In this way, you will never damage any vessels and will not have downtime period in your patient. So there will not be, the patient will not have any bruises after. And the study showed that the ultrasound skin scans and corneometry, so the moisturizing of the skin after the second, third procedure, we are having the density of the skin much more thicker. We are having moisturizing the skin. So you need to have the 3 procedures, because after one procedure you will have the result, but you will see that how your patient is going to book the procedure after and to have another one. I hope you can see the result after the procedure, that the pigmentation is reducing, the small wrinkles disappearing, and even we can work with the venous spots, so we can reduce the venous lines with the Xela Rederm, because the skin improves and restores itself, became much more thicker. Hands. With the hands, work with the hands is quite difficult because we are having lots of vessels under the skin. So by injecting with the needle, you need to place the needle exactly on the derma and to keep the angle no more than 15-20 degrees to be exactly in the derma. Or you can take a cannula and work with the cannula, but with the gauge no more than 22. You need to have a quite thick cannula not to damage the vessels under the skin. Or you can combine cannula technique with the papilla technique as well. So the classic redermalization, we can use on the patient who is less than 35 years old and taking the product 1.1, 1.8. Combined redermalization, I would suggest 1.8 or even 2.2 by working with the cannula. In this way, where you will have the support of the tissue by injecting with the cannula, so you will have the filling in the skin and also improve the quality of the hands, and moreover improving the quality of the skin of the hands by working with the papilla technique. I hope you can see it on your screen, because sometimes it not can be seen quite good. The spots disappear, the wrinkles disappear, and less visible the veins, the vessels of the skin became after the 3 procedure of the Xela Rederm. Hyperpigmentation. It is the most demanding procedure. I think the patient quite often asking you, how can I reduce the hyperpigmentation on my skin? So with the high molecular weight hyaluronic acid and succinic acid, which works synergically, you can reduce the hyperpigmentation. I'm not promising you to reduce it completely, but your patient will see the result and you will be quite satisfied after the procedure. So how it works? The succinic acid binding particularly affinity to the Cooper, which is active site of the tyrosinase. And tyrosinase, it is an enzyme which triggers the production of the melanin. So the succinic acid had the ability blocking of the tyrosinase activity. So we are having the blockage of the biosynthesis of the new melanin. Moreover, high molecular weight hyaluronic acid can activate macrophages in the alternative way and having the stimulation of the phagocytosis process. So the macrophages, they helping to remove the excessive melanin in the skin. So working together, they can reduce the hyperpigmentation. And the study showed that the reduction of the hyperpigmentation with the using of the Xela Rederm 3 times, 2 weeks apart, 3 procedures, the reduction of the hyperpigmentation goes to up to 35%. It is not the completely reduction, but your patient will be satisfied. The skin became much more lighter, and I will show you the result. So how do we work? Papillae. Inside the derma, we work with the main cell of the derma fibroblast. So please inject intradermally. So the reduction of the hyperpigmentation, as I said, it's not a magic wound, but the reduction is quite good. Your patient will be satisfied, as the doctor too. The spot reduction. So you can repeat the procedure twice a year for the better results, for the maintaining of the result, and also advise to your patient to apply sun protection screen, so the SPF higher than the 50. And redermalization, it is the best solution for the reducing dark circles under the eyes. So please do not mix the dark circles with the herniation, the fat herniation under the eyes. So you need to make a test before differentiation of the dark circles. If you stretch the skin with your fingers and see that there is lots of vessels, for example, blue vessels, sometimes they are red vessels under the eyes, which are making the dark circles under the eyes, then it is your patient. With this case, you can improve the microcirculation under the eyes, and you can promote the lymphatic drainage and also stimulate the reduction of the pigmented spots. So it is your patient for the redermalization. So 2 components, high molecular weight hyaluronic acid and sodium succinate, they will work in the synergic effect and promoting the microcirculation. So when the dark circles, they formed with the vessel component, with the small pathological vascularization, you can reduce it by injecting Xela Rederm. And it also needs to have 3 procedures, 2 weeks apart, to achieve the greatest result. So the papulas are quite small, 1-2 millimeters, 3 millimeters apart. And please put your needle exactly on the derma and parallel to the derma inject in this area, because the skin under the eyes is quite thin. So please do not go deeper than the skin. Be exactly inside the derma. I will show you the video how to inject. So the study showed that the moisture increasing after the 3rd procedure. So by not only reducing the dark circles, your patient will be happy by reducing also the small wrinkles under the eyes, the small wrinkles around the eyes in the temporal areas, in the crown fit. Without even using the botulotoxin, you will see the reduction of the folds, already formed folds, which are visible even in a static, not in dynamic. Static folds of the skin will be reduced as well, because the skin will be much more moisturized after the procedure. And another study, the doctor published the study in a Prime magazine. You can find it in primejournal.com. So the reduction of the dark circles, more than 40% after 3 procedures, 2 weeks apart. So how do we inject? We inject papilla technique all around the eyes. If you start injecting on the upper eyelid, please stretch the skin up to be always on a bone and to be safe on a bone. And also the Xela Rederm we can use to prepare our patient for the traumatic procedures, to reduce the formation of the scars after the plastic surgery. So before the plastic surgery, you can inject the Xela Rederm all around the eyes before 2 weeks before the surgery. And then 2 weeks after, you can promote the new cells for multiplication to reduce the scar formation. And this technique shows how to reduce the edematous component after the procedures. So after the surgery, definitely it would be the lymphostatic. So you need to make the lymphatic drainage. And in this way, you are injecting all along the vessels where the lymphatic system lays. So with the sodium succinate, we can work on different problems. We can solve the dark circles by increasing the microcirculation. We can work with the hyperpigmentation, with the melasma, with the spots, post-acne spots. And also we can promote the collagen production, preventing chronoaging, preventing photoaging, production of the new fibroblast growth, and by increasing the inflammation process in the skin. So two components, synergic, double synergic effect. You can reduce the skin aging process and battle different problems of the skin. Moreover, Xela Rederm received a prize in the Monaco Congress in 2017 by having the prize of the best skin enhancer. So it is the recognizable product from the Chile to China, all around the world. More than 50 countries are using the Xela Rederm. More than 1 million doctors injecting every day the Xela Rederm and having their best result with their patient. And it is quite recognizable product which works, which will help you in your practice. So the advantages of the Xela Rederm, that you can solve lots of different problems, and the Xela Rederm is unique formula. You cannot find another product like that. And I will show you the video how to inject. And please, if you have any questions, please write them down, and after the video I will discuss all the answers with you.
Hylual. Science and results.
Basic redermalization with Xela Rederm. Instructions for use. Indications. Tendency to swelling, deterioration texture and skin relief, wrinkles, hyperpigmentation, acne, post-acne, preparation for traumatic procedures. Hylual presents innovative solution to solve these problems. Xela Rederm. Injectable product based on non-cross-linked high molecular weight hyaluronic acid and succinic acid for achieving redermalization. Double synergic effect technology. Hyaluronic acid helps to activate anti-inflammatory mediators, restores and maintains water balance, contributes to the synthesis of basic structural proteins, provides mechanical support for tissues. Succinic acid helps to normalize microcirculation, contributes to lymphatic drainage, helps to regulate cellular energy exchange, has antioxidant properties, helps to prevent damage of the cell membrane. To solve problems such as tendency to swelling, deterioration, texture and skin relief, wrinkles, hyperpigmentation, acne post-acne, preparation for traumatic procedures. Perform intradermal papilla injection. Diameter of papilla is 1 to 3 millimeters. The distance between papillas is 5 millimeters. The course is 3 procedures, 2 weeks apart. Step 1. Cleanse. Clean off any makeup with micellar water and soft cotton pads. Step 2. Anesthesia. Apply anesthetic cream all over the face. And wait 15 to 20 minutes. Then cleanse the skin. Use antiseptic. Step 3. Redermalization. Ask the patient to look up and then stretch the skin, using the other hand for stabilization. It is important to emphasize that the injections must be very superficial. The aim is to work with the derma. Start the procedure from the inner corner of the eye. Here, the papillas are administered in a line-by-line pattern. To be sure that the procedure is performed safely on the upper eyelid, injections always should be on the bone, using the other hand to stretch the skin up for easier injection. The injection of the needle should be no deeper than the cut of the needle, approximately 1 to 2 millimeters length. In the middle third of the face, start injections from the center and proceed to the hairline. Diameter of the papilla is 1 to 3 millimeters, and the distance between them is 5 millimeters. Step 4. Post-procedure care. After finishing the procedure, apply contactless post-procedure care spray. Protocol. Redermalization with Xela Rederm. Contactless post-procedure care spray. It is important to apply sunscreen after any injections to prevent photo damage. Ultimate eye cream. Intensive eye correction cream. Anti-aging brightening serum in cream for youthful, radiant facial skin.
Hylual. Science and results.
Basic redermalization with Xela Rederm. Instructions.
Okay, if you have any questions, please write them down. I see some questions right now already appeared. Okay, is it better to inject 1.8, 2.2 with the cannula as you have much tissue support? Yes. So with the cannula, when you work with the cannula, please inject 2.2. It will have much more support. But what do I recommend? Anyway, if you are working with the cannula, divide the syringe in 2 parts. That one part you would apply under the skin. And one part you will inject with the needle exactly in the derma. Because we need to work with the derma. Despite the product will go to the derma and promote the cells, but damaging the skin with the needle is quite different. And putting exactly in the derma the product, it would be different result. So please inject with the needle. And about the repeating the procedure, how many sessions? So basically everything is quite individual to your patient. We recommend that the procedure must be 3 procedures 2 weeks apart. It is the session. However, I had in my practice the patient who was chasing me and asking for the 4th procedure on her neck because she saw the quite good results. Before that, before starting the other procedures, she told me that my neck will help only the plastic surgeon. But we started with Xela Rederm, and she was chasing me to have the fourth procedure. So basically, when you are working with the hyperpigmentation, yes, you need to inject 3 times. And to maintain with the results in 6 months after. And you will see by yourself how many procedures then you will need. It could be 1 and your patient will be happy. It could be 2 to maintain the greater result, to reduce more hyperpigmentation. Because when you work with the 1 session, when you have like 3 sessions and 1 course, your patient then go to the holiday and receive more sun damage to their skin. Then they will book by themselves and asking, you know, I've got another hyperpigmentation because I haven't put this sun protective screen to my face. So how many sessions after the treatment you will decide yourself, you will see the skin and you will realize with your patient how many after they need. And more questions. Can we use, I love the question. Can we use different concentration alternatively during the treatment sessions? Actually, yes, you can use different concentration. You can start with 1.1 and then increasing it to 1.8 to have more support to the tissues. But when you are working with the deformative type of the aging, when there is lots of edematosis component, you need to promote lymphatic drainage. So you will have this table which will help you in your practice to see what concentration for what patient is better to start with and continue with. So we have lots of booklets to suggesting how you need to work with different types of the aging. For under eye and tear trough, could we apply 1.8 when we don't have 1.1? Could we start with 2.2 in severe cases? I wouldn't recommend to work with the 2.2 under the eye. Why? Because it will attract the water and your patient will have swelling after the procedure. The swelling could last up to 3-4 days. So the best product for the under eye is 1.1. However, I work with 1.8 under the eye, and when it is the case, when it is quite wrinkled face with the wrinkled morphotype, when the skin is absolutely dry, take 1.8 even under the eye, but be precise in a derma. Do not damage malar fat because the patient can swell after the procedure, and the swelling, if you damage with the needle this area, so the swelling can last up to 10 days. It's not very comfortable for the patient. 2.2 for severe cases, face could be applied in front of, yeah. For severe cases, when the skin is quite damaged with the sun, when the skin is quite wrinkled, and with the patient older than the 50 years old, you can start with 2.2, but be very careful working with the under eye area with 2.2 because it can cause the swelling, but the results are quite nice. Sometimes I take patient 60 plus years old with the 2.2. It deals with the scars or only with the hyperpigmentation and post-acne. Scars, yes, the scars which is hypertrophic scars. You can work with the Xela Rederm, and usually post-acne scars, they're hypertrophic because we do not work with the scars which is under the skin. I wouldn't call them keloid scars because with keloid scars no one is injecting them because you can promote them to grow more. So the hypertrophic scars, which is below the skin, you can promote the skin cells to multiply and to make them even with the other derma. So post-acne scars is the something, my video disappeared. Something bad happening with the internet connection. So thank you very much. Thank you very much for your time, and I think we will keep in touch. And if any questions, please address them to the company, and I'll try to help you.